So we are, early August. Thousands of teenagers will head to college this month, and many of them for the first time. It is a major milestone, not just for them, but for their parents. And we have one of them right here, Dr. Todd Ellerin from Saucer Health. So this is exciting, right? Is this your first one going off to college?
No, it's the last one.
It's the last one.
I'm excited for Brett, but we're, also sad.
Well, he's not local. He's going to South Carolina, right?
That's right.
Going to the state of South Carolina.
Right.
Where's he going to
College
school?
of Charleston.
Wonderful.
Yeah.
That'll be great. So who's more excited about it, you or him?
He is. Yeah, you're right, because it's the last one. So I'm feeling the feelings. I think we are. Yeah.
So let's talk about reality, though. As they grow up and as they go to different areas, he's a doctor's kid. So is he up to date on it? He knows to be up to date on his vaccines. But do you worry about other kids that he's in the environment with, in the dorm with?
Listen, when you have hundreds, thousands of kids in close proximity, I think I'd focus on the meningococcal vaccine. It causes this rare form of meningitis, but it focuses on college-age kids who are in the dorms. So the question I'd ask the pediatrician is not, has my child gotten the meningitis vaccine, but how many? Because there's actually 5 different types of strains, 2 different vaccines. So ideally, you want to get both vaccines.
So in the preparation for this segment, you were telling our producer, Sarah Stolberg, magnificent producer, a list of other health topics that you've discussed with your son. So obviously, you've shared it with your family. Share it with the viewers because it can help.
Right. So I want to use an acronym, and it's going to be College Ready. Okay?
College Ready.
And essentially, what it's going to look like is the R is refill supplies. Make sure you know where your medications are, and make sure you know where the pharmacies are from where you're going. Okay. Also, have a little health kit with thermometer, some Tylenol, ibuprofen, Band-Aids, just basic stuff. So you're ready. The E is eat well and exercise. It's easy to skip meals when you're in college. There's a lot of freedom. You may replace it with an energy drink or coffee. Try not to
2 in the morning and go get pizza.
That's right. Try to eat regularly. If you can exercise, even as little as 15 minutes a day for both days, that improves mental health. That improves your ability, concentration, and academic performance. The A, alcohol awareness. I remember for me, back in 1987, the fall, I had a bad experience with alcohol intoxication, and I learned my lesson. Too many shots. You got to be honest with these kids, right? So alcohol, you want to know what's your limit. Make sure your friends around. Make sure you don't leave drinks uncovered. That type of thing. The D, dangerous decisions. Drugs. You got to be super careful about drugs. It's a different generation than we had, right? Fentanyl can be in some of these counterfeit drugs, and it just takes one time. So you want to make sure you don't experiment with drugs. And if you are experimenting with drugs, make sure you have that Narcan, the fentanyl rescue. And the last thing is your mental health. Mental health is as important as physical health, right? So when kids leave for college, that they get homesick, depression, anxiety, things like that. Know where, student health services. Don't wait too long to reach out to get help.
And let's talk about sexually transmitted diseases. What do kids need to know about the risk on campus right now?
Right. I think they're on campus. Right. It's important to have, again, am I going to sit down and lecture with Brett? You want to try to have a bi-directional conversation. It's difficult to talk about sex, but it's there. Just know the risks, especially if you're having sex with multiple sex partners. Hopefully it's protected. If it's unprotected, you want to go and get tested. You want to get screened. Things like that. What people don't know, a lot of sexually transmitted infections are asymptomatic. You don't necessarily have symptoms. So that's why screening is important. I think just having an open dialogue can help. It's not easy, though. Well, let's face it. I'm not pretending that that's easy to have.
Going to college is exciting, but man, you got a whole list of things you should be prepared for. Dr. Ellerin, it's great to see you.
Good to see you, Eddie.
Weekend. Maria?